of our New Zealand NGO Common Knowledge Trust series called What the Fuck Dubs. Woo! Not supposed to say that. WTF is going on in the childbirth conversation. Sorry for that. So, what I want to do is talk about interventions. So, I'm the director for Common Knowledge Trust, and you can find us at www.commonknowledgetrust.org. And we house the birthing better skills that hundreds of families developed in the early 1970s. And I gave birth in 1970, and then my last birth in 1982. So the reality is I really understand globally what's been going on in childbirth, and the WTF started way back even when I gave birth. And that you can find in the first of this series called The Missing Element in Childbirth Stories. Today we want to talk about interventions. So when I gave birth in 1970, the whole generation of us, the word interventions was not used. So in the United States, where I gave birth, although I live in New Zealand now, which has a different history, and your country may have a different history as well, we went into the hospital and we had the assessments, the monitoring, and procedures of that day. That was the evidence-based practice of that time. That was sort of a bit post-World War II, but it had evolved a little bit since then. The cesarean rate was 4.5%, and the rest of us labored, whether we labored for hours or days, whether we coped well or not, whether we had a good outcome or not, whether there were risks or not. All of us labored because the medical profession really at that point wasn't capable with the diagnostic tools. And so when we look back on it, it seemed quite crude. But when we look back on the modern medicine of the 1970s compared to the millions of women worldwide who still live where there's no medical care, it seemed very modern. And many people want that. So I want to tell you that between 1970 when I gave birth and 1982 when I gave birth last, the word interventions was being used. Now, how did that come to be? Well, it came to be because the second generation of natural birth advocates that sprang up in the 70s and 80s compared to the ones that had sprung up in the 50s were people who, like both groups, were quite anti-medical. And there was reasons for that. Childbirth, pregnancy and childbirth are normal life events. But the word normal doesn't mean that it's easy or it's copable or it's a good outcome or everything turns out rosy. And I'm going to talk about that in another series, in this WTF series, because it's important for you to know. Because you're pregnant now, I'm not going to be pregnant again. You get to change the future by changing the present. How we talk, how we think, how we act, and what we expect. So when my generation gave birth in the United States, there were two things going on. One is Lamaze classes were taught in every hospital around the United States, or people went to Bradley classes. And those were the first childbirth preparation classes, which meant that multiple millions of us from the 60s to the 70s learned some form of breathing and relaxation skills. We had no choices, so we used skills, which meant we went into hospitals and we had the assessments, the monitoring, and the procedures that were accepted within the guidelines of practice or the evidence-based system of the day, and we worked with and around them. That meant that the labor and delivery nurses in the United States and the obstetricians saw multiple millions of us coping better and managing better, even though we may have had risk factors and issues that came up. And they saw fathers coping. They were just permitted in, and they were permitted in because women demanded them. Because prior to the Lamaze and Bradley classes, there were no childbirth classes, and skills weren't thought of. We've always worked globally on the truth. There's no way to know what your birth's going to be like, and that's followed, unfortunately, inaccurately with the concept that therefore there's nothing you can do to prepare for it. So in the 60s and the 70s, childbirth preparation was skills, exclusively skills. which meant we saw it as a high societal expectation that we all learn skills and use our skills no matter how immature and unevolved they were. They were something, and they worked to help us cope and manage better. And we did that around all the assessments, all the monitoring and procedures. The next generation of, oh, and I have to go back a little bit because that first generation of birth advocates in the 50s and the 70s, the reason that they promoted Lamaze and Bradley and Grantley Dick Reed, that was popular in New Zealand, was that those three obstetricians also saw that birth was being medicalized. And they wanted to distinguish between those women who were low risk and those that were high risk. And that was the huge mistake that was made. They just should have seen 100% of pregnant women give birth, and we should all have skills to birth our baby because it's an activity that we do with our baby, no matter the circumstances, where it occurs, who's present, or what happens to and around us. So there was a huge mistake made, and I've talked about that in other YouTube videos about it. So the first natural birth advocates separated, they made the oppositional approach, high risk versus low risk. There is no variation. There's no opposition. It's 100% of pregnant women will give birth. So that mistake was made. And so a lot of people using Lamaze and Bradley were both not low risk. They were very high risk and still using skills, and they coped better. And those women who were low risk, not enough of them achieved the goals, which was a natural birth, pain-free labor with no medical care. And so the next group of birth advocates in the 70s said, see, skills don't work. Birth is instinctive. Women just need to have choices to say no to medical care. And what they did was to say no to the assessments, monitoring, and procedures, which they lumped into one word, which was called interventions, with the implication that an assessment, a monitoring, and procedure, an intervention now, is imposed on women and unnecessary, and that women just need to tell their birth professionals what they want for their birth, and the birth professionals should be giving it to them. This was an absolutely huge mistake because, first of all, babies don't come to plan. And second of all, they don't have a responsibility to give you anything. It's not their responsibility to give you the birth you want, and you can't plan the birth that you would like. You have to do the activity, and there is no way to know what your birth's going to be like. But sadly, because those three obstetricians didn't set up skills for all women, even though all of us in the United States learned them, we had in our mind that they were only for low risk, normal pregnancy and birth. So that was a huge mistake. And then dismissing skills when in fact labor and delivery nurses and obstetricians for a 25-year period saw multiple millions of women and men successfully using them so that they could cope and manage better. When the natural birth movement of the 70s and 80s came along, they dismissed skills. And they just wanted women to be left alone, as Michel Audin said. And if they could get midwives, the midwives were supposed to sit in a corner and knit and let women discover birth by themselves. So we have a problem. Skills did not evolve. And the idea was just say no to interventions. So I want to tell you, and I don't actually have this, I was going to have a chart of interventions. So what I want you to do is to make a list of interventions. And I will find some way to put these up at some point. So when our trust teaches in New Zealand, strengthening the partnership workshops in New Zealand, we ask midwives, what's your goal as a profession? They want more normal births and they want more home births. And what's stopping that? And they say intervention. So we make a list of them. There are 28 of them, right? So as women, we're asking each other to avoid 28, at least 28, interventions, assessments, monitoring procedures in order to achieve that normal birth. That's impossible. We're just being crazy with each other as women. So we're dividing births when we are all giving birth because we're pregnant. So We now hear women say, I wanted a natural birth, but I was induced. Well, you still had to do the activity of birthing. Oh, I am having a cesarean because they wanted me to have a cesarean. Okay, use skills on the way to the hospital while being prepped and in surgery at your baby's birth. Oh, they imposed these interventions on me when I didn't want them. Okay, we had assessments, monitoring procedures, and we use skills. And that's important for you to understand. Interventions go two ways. You can intervene to stop an issue from becoming a problem, or you can intervene to stop something from happening naturally. But then there's that word natural again. So, natural does not mean that women cope well and that they have good outcomes. Natural has always meant when there's no medical care that anything that can happen at birth can happen at birth and might happen, whether it's challenging or positive. And we have to understand that when we have an intervention or an assessment, monitoring a procedure in birth, it is because we live in a modern society. And if you don't want to have any of those things, then never see a doctor. Never go to the hospital. Never go to a doctor's appointment. Unless it's not legal for you to do that, you have the legal right to just never have any medical care. You can live like women do now in third world countries where there is no medical care. You can do that. That's okay. You can do that. If you step into their environment, into a doctor's office or a midwife's office or a hospital, or a midwife comes to your home, you are under their guidelines of practice. And you have to agree and abide by those things. Now, you also have to ask yourself, do you really want no assessments? Do you really want no monitoring? Do you really want no procedures? And if you change from saying interventions to assessments, monitoring, procedures, you will realize you have a different feeling about them. Because 99.99% of all women who live in the modern world don't want to risk themselves or their babies. It's as simple as that. We don't want to go back to living in rural villages, and people in rural villages want the health care that you have. And so you need to understand that if you're going to have assessments, monitoring procedures, the best way to deal with those things is for you to become skilled. That's what we learned in my generation. And we tried to explain this to people, to the next natural birth advocates. Skills must be evolved. And no, they just collectively dismissed them and said, no, women need choices. See, skills don't achieve those natural births, those pain-free labors without medical care, because those were the wrong goals. So when you look at childbirth, there are two things in childbirth that have always been globally. Women suffering, which has dick to do with whether there's a problem, and issues that become problems, and that's risks. So when I gave birth in 1970 and the cesarean rate was 4.5%, those were done because of the risk to women's life. All the other risks were still labor and delivery, whether they had a good outcome or not. Twins, breaches, preeclampsia, diabetes, strep infections. And these are the things that you really need to understand about. For instance, did you know that germ therapy was so recent? Very, very recent. The obstetrical profession was only established in 1952. That's in my lifetime. But take a look at this. Immunizations. Penicillin. My grandmother died of pneumonia prior to penicillin. And then take a look at this. Take a look. Rubella was developed in 1969. Rogam for Rh negative in 1968. Maybe you guys weren't alive. I had polio vaccines. So we have to understand that the reason that people like the modern world is that the medical profession is doing its best to reduce issues from becoming problems. So it's really important that you understand that, WTF around the childbirth is that we are using words that lead in a very, very, very warped direction and have been since the mid 1970s. And we need to reclaim it. I'm not going to have another baby. You get to reclaim it. So, this is how you can do it. You need to become skilled. Thankfully, now there are a bunch of skills based methods. Lamaze and Bradley and Grantley Dick Reed are three of them. Our Birthing Better developed in the early 70s, not as an evolution of their skills, but an evolution of birthing skills, along with how to prepare your body to try to reduce and prevent long first and second stages, as well as working together as a team with shared common knowledge skills based on our human body. Then in the 90s, you started in the 2000s, you got hypnobirthing, hypnobabies, calm birth, birthing within. Those resources are very helpful, yes. They target low risk normal births for natural birth, pain free labor with no medical care. Birthing Better, we developed them as hundreds and hundreds of families for our babies' births, whatever that was. And so you need to understand that interventions are just medical assessments. They're medical procedures, they're monitoring. They will not stop you from doing the activity of birthing your baby. You are birthing your baby. It is an activity that you are doing. And you can have a partner help you do it, help you cope, manage, deal with, work through, handle, stay on top of, and feel in control. And certainly with Birthing Better, you can use Birthing Better to prepare your body to reduce and prevent some major issues from becoming problems. And when you become skilled, you are a better negotiator with your healthcare provider. When your healthcare provider sees you upset and freaked and ideological, they don't know how to deal with that. When you give them a long list of things you want and don't want, they don't know how to deal with that. If you are calm and collective and working through this journey, they will talk to you. We have tens and thousands of stories that tell us that. We have tens and thousands of skilled women and men with medical high risks who use skills to cope so that they aren't suffering. The medical profession doesn't want to see you suffering, nor do they want to see issues becoming problems. So first, use skills so that you don't suffer, so that you cope and manage and can negotiate well. And if you have a risk that can become a problem, then use skills to try to prevent that issue from becoming a problem and keep using your skills even if you are lucky enough to live in a country where there is medical care that can prevent that problem from becoming a disaster. So this is the second video in the WTF is happening in the childbirth conversation. We hope you subscribe. We've got lots of other videos. I've just talk, because the families that develop Birthing Better asked me to carry this forward. And I foolishly in the 1970s said, okay, I will. And yet, to get the message out that we need a skilled birthing population has been very challenging. So if you become skilled, you will tell your sons and daughters, when you're pregnant, it's normal and natural for you to learn, self-learn skills, and use your skills to birth your sons and daughters. And that's what's important. See you later.